Good afternoon. Today we're going to talk about vitamin D. I'm sure that everyone has heard different stories in the news about vitamin D and coronavirus, and just a whole lot has been said. Today I'd like to give you 6 things that vitamin D is good for. The first thing is that people that have vitamin D deficiency tend to have more viral infections. This was well known before COVID-19 came. There had been many studies that showed that kids who were vitamin D had good levels of vitamin D had much less respiratory infections in the wintertime. Vitamin D, as a respiratory immune chemical, it's been well known for many years that vitamin D plays probably one of the most important roles in the immune system with regards to respiratory infections. And in the wintertime, we see a lot of more viral than bacterial infections. So having good vitamin D levels, patients will tend to have less viral respiratory infections in the wintertime. So let's get those vitamin D levels up. Number two, patients that have vitamin D deficiency tend to have more bone, different from arthritis, but they tend to have more bone pain, kind of achy, like bone pain. And it's been shown, again, there's been many studies out there that show patients that get their vitamin D levels up tend to have less of that bone pain. As a matter of fact, we have heard of, maybe you've heard the term osteomalacia, and that's a term used when the bone is really doesn't have enough calcium and vitamin D, and the bone is easy to break. And a person might go through what's called osteomalacia, and then they can have osteopenia, where they're losing more and more vitamin D and calcium. And vitamin D, by the way, holds the calcium in the bone. So its function is to hold the calcium in the bone. So if you don't have vitamin D, calcium is seeping out of the bone, and eventually a person could have osteoporosis. And that's a situation where bone cracks very easily. You could fall on carpet, and a person could break a bone in half, snap the bone, because they don't have the calcium they need in the bone, because they don't have the vitamin D to hold the calcium in. So again, the third value of having good high vitamin D levels for people is that it prevents people from having these fractures from just falling or bumping up against a wall, or having a very minor incident and actually breaking their bones. Number 4 is muscle pain. Patients that tend to have this kind of achy muscle pain most of the time, and they don't know. And some people might write it off as, I'm just getting older, and my bones are getting achier and my muscles are getting more sore. But in reality, their vitamin D levels are very low, and those low vitamin D levels tend to cause muscle pain. And so we want to make sure that that our muscles we're not having that muscle pain. And so one of the ways that we can find that out is to go to your doctor, because you won't know unless you go to your doctor or your provider and ask for your vitamin D level. And they will tell you if you're vitamin D deficient or your vitamin D levels are good, and exactly what you need to do. And so I would encourage people to go and get your vitamin D levels checked. Very important vitamin. Number 5 is people that are vitamin D deficient tend to have low mood. They don't have clinically depression, like really low where they have to be treated and they're isolating and they're just but when you have that low vitamin D, your mood just tends to be kind of low, and you tend to drag a little bit more. And that, again, there have been many studies that show that high vitamin D levels tend to increase our mood. And for people that live further from the equator, such as people here in America and the UK and Canada, we tend not to get a lot of sunlight. And so we really have to be mindful about our levels of vitamin D, because no sunlight in the wintertime, and we have more months where we don't have sun, and we know that the people tend to get a little depressed in these months where there's not a lot of sun. And then if you put on top of that low vitamin D levels, that could set a person up for really feeling kind of crappy, mood low, not having that, a spirit of joy and the mood being up. So check the vitamin D level. If your vitamin D level is low, get on some vitamin D supplement. And number 6, something that kind of goes right along with the low mood is patients that tend to have low vitamin D levels tend to be fatigued. They just kind of have that tired feeling. And again, people that fatigue, you can have fatigue from a number of things. But one thing that we do know that is people that are vitamin D deficient tend to be more fatigued than those patients that have their vitamin D levels that are up. What we want to do is we want to make sure that we're doing all of the things that make us feel good physically, emotionally, and spiritually. And so here we have a vitamin that has been in the news for the last several months regarding this COVID-19 virus. And quite frankly, there is so much compelling evidence to show that those patients that have vitamin D deficiency did significantly worse when they contracted the COVID-19. And that wasn't just here in the United States, that was around the world. If you think back to one of the previous videos I did, I cited studies where they showed that patients that were hospitalized, that had that were vitamin D deficient, tend to do significantly worse. And so we want to get those vitamin D levels checked. Okay, so one of the things that I really want to point out is that, and I pointed this out in the other video, that people of color, we have melanin in our skin. And so even with the sun rays coming in on our body or our skin, we don't have that melanin stops the conversion of that chemical that converts into vitamin D3. And so we don't get that active form of vitamin D3. So it's safe to say that for most people of color, they are vitamin D deficient. What I would like to put out there is, especially for people of color, to go get your vitamin D levels checked. We talked about the reasons and some of the things that can happen if you're vitamin D deficient. So go get them checked, and let's have healthier, let's live fuller lives. Also, one other thing I want to mention is, a lot of people will say, do I take vitamin D2 or D3 or take one? Most experts will say that vitamin D3 is a more active form, and it's better to take the vitamin D3 than the vitamin D2. But I would say to you, is to talk to your primary care provider, and they will tell you, given your health conditions or condition, what's best for you. And so with that, if you want to know more about vitamin D, hit the like button, subscribe, and we'll see you next time. Thank you.